The latest numbers are in from Monroe County. Officials there are reporting 558 new cases today alone. 339 people are hospitalized with the virus in the Finger Lakes region. 97 of them are in the ICU. While COVID cases are rising locally, concerning levels of positive cases and hospitalizations are also going up outside our area, including in places like Wayne and Ontario counties. Alex Love spoke to the health department of both areas and joins us from the newsroom to explain what they're up against. Alex.
Leaders of both county health departments are going into this holiday season worried, Allie, because positive coronavirus case rates are already higher than they were at this time last year. And this time around, we have a vaccine. But people aren't turning out in high enough numbers to keep the spread down. Per capita, both Wayne and Ontario County COVID-19 case rates are more than double the per capita rates in Monroe County. Since the last week of October, Ontario County went from averaging 36 cases a day to more than 83 cases per day this week. Meanwhile, Wayne County was averaging 42 cases a day by Halloween, but they have since jumped to averaging 87 coronavirus cases per day. The CDC has labeled them both and the entire Finger Lakes region, frankly, as a high transmission area where everyone is recommended to mask up when indoors, which health experts with each county call for people to do when they're traveling for the holidays.
If you are going out and you are in an indoor setting, regardless of your vaccination status, everybody should be masked. If they're old enough to be masked, so older than 2. I even recommend if you're going to be in large gatherings outdoors, but you're not able to social distance, that if you're around large groups of people, mask indoors and outdoors and get vaccinated.
Both Wayne and Ontario counties still have about a third of their population without a single dose of the coronavirus vaccine, something doctors and health experts with the county say is the main contribution to this upward trend in cases. Live in the newsroom, Alex Love, News 8.
Alex, thank you. And doctors with the Department of Health are also noticing cases in children contributing to the upward trend. They say this can be dangerous since they can pass it on more frequently to those vulnerable without noticing it.
FDA and CDC advisors have authorized COVID-19 vaccine boosters for all adults. Officials moved to expand emergency use authorization of both Pfizer and Moderna's booster. Several cities and states have already expanded booster eligibility for all adults, including right here in the Finger Lakes region. Governor Kathy Hochul made that announcement earlier this week due to our high transmission rate. The decision comes as cases nationwide are spiking, especially in the upper Midwest, and health officials work to slow a potential additional surge this winter.
And tonight, doctors are weighing in on the importance of the booster shots locally. They say because the protection of COVID vaccines appears to wane over time, they're recommending people get their third shot around 6 months after their last dose. Doctors say you might feel a few minimal side effects 24 to 48 hours afterwards, but none are as serious as getting COVID itself.
Fortunately, what we're seeing in all the patients, and colleagues that get this, the reaction to the booster shot is very similar. In most of the time, it's often no worse at all than what type of reaction you had with the first or second shot. Low-grade fever, kind of chills, sore arm, malaise, tiredness. That's the most common.
Doctors say while getting the booster shot is important, it's even more crucial that those who haven't been vaccinated get their first shot.